All right. We are live on the Regen page. What's up, everybody? I am Daniel Tribby alongside Dr. C here. We're the owners of Regenerative Sports Spine and Spa here in the Orlando area. So we do these for you guys every Monday just to kind of give you some insight on typical problems that are seen in our office and give you kind of a different way of looking at how you can fix them outside of the traditional methods that so many people use, like steroid injections and pain pills and surgeries and that kind of stuff. So try to bring you guys a little different angle of value here. And today we're going to do that for neck pain and some of those symptoms that some of you may be feeling that go down your arm. So how are we doing today, Doc?
Good. How are you doing?
All right. We doing the thing. So let's get into this neck pain discussion and some of the symptoms that may go down the arm that a lot of people may not associate coming from their neck. So what's the anatomy look like in the neck?
Well, this is the anatomy of the neck. We have the bones, the vertebrae, we have the discs, and then over around the back here, we have the joints, and these yellow things are the nerves. So that's kind of how that works. And a lot of times, you can have pain from the discs, you can have pain from the joints, and you can have pain from the nerves all at once or separately. Just depends. We'll just have to figure out where that might be coming from. So, yeah.
How do you determine which one of those, or how would a person determine which one of those areas they may be having pain from? I'm assuming the symptoms relative to those areas are different.
Typically, yes. So if you're having more, let's call it joint pains. So typically you'll have pain with turning your head or looking up or, those kind of repetitive motions type of things from side to side. If you're having more disc pain, then a lot of times it's bending forward, reading, and then that in turn can press on a nerve and cause pain, even radiating down the arm. And so that's where that correlation comes in with shoulder pain and neck pain. A lot of times it doesn't, even though you have shoulder pain or around this area, doesn't necessarily mean it's coming from the shoulder joint. It can actually be coming from the neck. So.
Right. So all those nerves that are up here, they leave the spinal cord and go all the way down into your shoulder, down your arm to your fingers, and they're all depending on what level they are. So the higher they are in your neck, the closer those nerves are here, and the lower they are, the further they go down into your hand and fingers. Right. So any sort of disc issue that you have that would compress a nerve will then give you numbness, tingling, burning, or pain wherever that nerve goes down the arm. Right. And then sometimes occasionally it can be towards the shoulder blade too. It can come down the backside through here. So, and traditionally, we talk about this just about every week. Most people would handle this situation how? By what means?
Medications, oral steroids, physical therapy, and then followed by typically injections, either epidural steroid injections or joint injections, things like that. So...
and eventually, but hopefully not surgery, right? And we know that surgery in the neck, if you're in the working class, as in like those more of that blue collar working individual, most of those people that end up having those surgeries, I think it's about the 80% of them go back to their activities beforehand, right? Like whatever they were doing work wise, about 80% of people after they have a neck surgery will go back to those activities without restrictions. Now, compare that to the low back, there's a big difference. It's like less than 20% will go back to those activities. So, and the main reason being is that your neck only has to support whatever size bowling ball you have versus your back has to support everything from the bowling ball down. So when people have surgeries, like we hear this, I had a neck fusion, or I had a disc replacement. What are these surgeries actually doing? Like, what happens?
Well, if we're talking about the spine, so if you have a fusion, you're actually fusing these two bones together, so it makes this disc area not move. So that's the fusion. And so if you're having a disc replacement, you're actually replacing the actual disc here, with the metal with cushion in that area. So now if you have a fusion, think about it. It's like if you're fusing these two bones, then this area can't move. I mean, these discs are meant to cushion your movements. So then if this can't move, then you end up having more stress up here as well as down here. And then eventually you'll have problems at both of those areas after a few years too.
Right. Yeah. So most of the time if you remove one of those discs, you're going to then be putting pressure to the other discs above and below it. They have to take on the extra load because now, which was once two bones, has become one solid one, right? So they
Right.
remove the quote unquote source of pain as it relates to the disc, and hopefully some of the nerve pain if you have some of that going down your arm. But does neck surgery relieve all of the pain associated with the neck typically?
Typically not, because most of the time when you have spine pain, whether it be neck or back or mid back, it's typically not just the disc. You know, it's like we're talking about when you have imbalances, you're talking about the joints, the ligaments internally are inflamed or might have micro tears, and the disc. So if you have a fusion, you help that disc area, but then you're not actually treating the joints or the ligaments or the nerves. So a lot of those will still have issues, and that's why a lot of surgeries help, but they don't help necessarily enough for most
Right.
people. They still have pain after surgery, which is a
Yeah.
very common thing. You know, a lot of people think that you have surgery and you're going to be all better, which is not really the case most of the time. I mean, sometimes sure, but there's a lot of different reasons that you have pain stemming from the spine. It's not just one thing.
Right.
So that's what makes it so hard to treat in general. So
So outside of steroids and medicines and physical therapy, which we're big believers in, and surgery, what can we do that might address more of the problematic areas and actually influence long-term change?
well, of course, we're talking about our regenerative medicine options. If I can speak today, regenerative medicine options. So basically, at this point, we have platelet-rich plasma. I really can't speak today, which is essentially growth factors and anti-inflammatories. But typically, if you have herniated discs, that's not quite strong enough. You don't have that enough to help with a lot of the repair. Typically, if you have platelet-rich plasma, you're talking about ligaments and tendons and muscles that are helped. But if you're having disc or joint issues or cartilage issues, you know, even you do have cartilage in these small joints there. And so that tends to be not enough to get the proper repair that we want. So the next option is the stem cell, which with bone marrow is what we use in our office. I mean, you can also use some adipose tissue, which is fat, that has live stem cells as well. So those are really the only two options, stem cell wise, that are possible.
Right. And then why is that, in our professional opinion, why is that the better route to go?
Well, because you have actual live stem cells there, and the stem cells are the blank cells that can become what you want them or need them to be. So if you inject them into, let's say, a hernia disc and you have some micro tears in the covering, then you can help some of those micro tears improve and make that disc healthier. And then also with cartilage, you can help, you know, the cartilage be healthier as well if you inject it there. So there's a lot of benefit to that. Whereas if you just have the plasma and has some growth factors, it's just not strong enough to get those changes that you really want and need for these issues.
Right. And you have the added benefit of being able to address all of those areas, right? So when you do these injections, like everybody's come to see you, they brought an MRI, so you know exactly where you need to go. But if somebody has a herniated disc that's causing some nerve pain down their arm, right, or they have that lovely degenerative disc disease that we hear thrown around all the time, right? And so you're not going to just touch the disc though, right? You're going to try to get all the other areas that may potentially cause or be causing pain or inflammation.
Absolutely. So when we treat the spine, it's like I actually do all the areas. So if there's two disc areas that are a problem, then I inject both the discs, then I inject the joints that are correlative to that area. in the epidural space around the nerves as well. So all of them, and that affects the internal ligaments. And then if there's any micro tears in the ligaments, it helps them. So really we do a complete treatment if we're going to do if we're going to treat it. Just doing the discs, you end up having people that still have pain because of the reasons that we said before. Pain stems from multiple areas in the spine. It's not just one most of the time.
Right. And so you get that added benefit of being able to address all those areas and then not having to come back later and go, well, yeah, it's better than it was, but I still have pain. I hear this all the time.
Right.
Like, I'm better than I was, but I still have pain. And these people end up defining who they are and what they can and can't do by their injury. Right. And that's such I think a dated way to treat people is via the same steroid injections that don't help with the cause of the symptoms, doing surgery to fix one problem, but still not eliminating all the problems. And then people still have the steroid injections afterwards to try to control the pain if they have the surgery. And the more you do this stuff, the more you're just degrading the tissues there. The more surgery you have, the more injections that you have that are from steroids, you're just more and more damage to those tissues there. You're just in this endless cycle of pain and then steroid injection to address the pain, but causes more degradation of the tissues later, which causes more pain. Then we have another injection, then you got no more, and there's just this pain cycle that never, ever ends. So at least with the regenerative medicine process, we get to address that pain cycle with a natural source, a source that comes from your own body's unique ability to heal. And we can harvest that tissue and inject into those spaces, get all three of them, disc, bony anatomy, space around nerves, and really help change your body for the long term, right? So people who've done these stem cell procedures, have you had to repeat any of them in the neck? Like if somebody's doing the bone marrow, and we do those in the neck, have you had anybody need to repeat those?
I have not in the last few years. So it's like, it works really, really well.
Okay. Yeah. So what would be are there any limitations after having this procedure done? If you go the stem cell bone marrow route, I don't know why that was so hard to say. Are there any limitations following that?
Absolutely. For the neck especially, I like to be a little bit careful. I mean, the discs are small, and we put some fluid in there. So I do have you stay off from any heavy duty workouts or lifting or anything for about 3 to 4 weeks. So we just want to be careful and then have everything stay where we put them as well. It's like we put the cells in the discs, we want them to stay in the discs. We put the cells in the joints. The more movement you have, the less they'll stay in that area, and they can translate into other areas of the body, which is not necessarily a bad thing. But, it's like, since we're trying to get this area to get better, then that's where we want it to stay. So at least 2 weeks to 4 weeks of limited activities with lifting and sports and things like that. But other than that, it's like you have a lot less downtime than, let's say, a surgery, which you might have 6 to 8 weeks, right? But then improvement-wise, so you typically start getting benefits around a month, and then improves over time as well. So which is great. It's like you give it the proper time it needs. Then you have, after a couple of 2-3 weeks, then you get on the proper physical therapy program, which helps support it more. And then, you can really do a lot of good with this.
Perfect. Love it. Love it. Anything else in regards to neck pain and symptoms that may be going down the arm, and what we can do from a regenerative medicine standpoint?
No, I think we covered it pretty much all, but yeah, so anywhere from your shoulder blade to the neck, and you can have radiation to the head as well, and down the arm. All of that can be from the neck itself. So don't be afraid to come in and find out what the actual issue is, so that we can help treat it for the long term.
Perfect. Awesome. Well, thanks, Doc, for another Monday rendition of our Fix Your Body with Regenerative Medicine Live. And we'll be back next week to educate you guys some more and bring you some more ideas on how you can take care of your body without flooding it with drugs and steroids and unnecessary surgeries. So if you are in the Orlando area, we are in the Lake Nona side of town. So if you are interested in having any part of your spine or joints looked at from a regenerative medicine standpoint, we would be more than thrilled to help guide you down the right decision to do that. And if you are not local, you're coming from out of town, we have really great VIP packages and places for you to stay, as well as a car service to get you to and from. You'll be very well taken care of in that space. So thanks again for watching. If you have questions or comments, please drop them in there. We always go back and answer those. I hope everyone's staying well, staying healthy, and we look forward to seeing you guys again next week.
All right. Thanks, Daniel.
All right. See you, Doc.